So I wanted to show just a couple the most common mistakes when you're doing this zirconia crown preparation. So here is your final completed preparation. I took it out of the Typodont here, so I had another one that I prepped later. But remember, it's a cylinder. So if you're doing a cylinder, what is the angle of your burr? That burr should be straight up and down. It should be parallel to the long axis of the tooth if you're doing an anterior, or perpendicular to the occlusal surface if you're doing the posterior. So you can see it straight up and down. A very common mistake is people tend to prep more tapered. So if you follow the angle of the preparation here, you can see from the side view, what's my burr angulation? It's right here. You need to be straight up and down. If you're angled, what ends up happening is that you're over-reducing at the axial occlusal line angle, and you're leaving, more importantly, is if you're angled, where's the tip of the burr? The tip of the burr is not against the root of the tooth. The tip of the burr is out in the sulcus somewhere, tearing up the tissue and leaving ledges. You can see that ledge right here. That ledge is what's going to prevent your crown from seating. So especially as you're going around those line angles, people tend to start angling their burr. So just remember, anytime you're below the tissue, keep your burr straight up and down so that you don't leave these ledges. You want to make sure that your gross reduction racetrack axial depth cut step, you want to make sure you can clearly see that racetrack. Remember, I can kind of show you from the side here, your racetrack needs to be the full thickness of the tip of that burr all the way around. So you can kind of see it all the way around, which is 0.8 millimeters all the way around on the lingual, interproximally, everywhere. So you can see that clearly. If I look at that, there, you can see that racetrack all the way around. A common mistake, especially on the lingual, because it's harder to see, but I'll hold these side by side here. If you look, you can see on this one here, you can see the racetrack on the interproximal and then on the buccal. But as you start to go around towards the lingual, that racetrack is kind of indistinct. You don't really see it anymore. It starts to disappear. So you can kind of see, if I hold these side by side, you can see on the one on the left, that's our ideal one. The one on the left, you can see the racetrack all the way around very, very clearly, the thickness of that burr. On the one on the right, as you go to the lingual, that racetrack starts to disappear. So when you're evaluating your preps, you want to make sure that you see that racetrack immediately. If you have to think about it or question that it's there, just go back and do a little bit more so you can quickly identify the racetrack being there within a millisecond. Remember, the racetrack, the width of the racetrack determines the size of the prep when you're done. We designed the burr so that it removes the right amount of tooth structure if you make that racetrack all the way around.